Now, it was supposed to be a new year, a post-pandemic 2022, one where we got over the pandemic. Instead, it is a year of a new variant, one that is wreaking havoc across the globe. Omicron is currently shaking the globe to its core thanks to crippling staffing shortage caused by the variant. Hospitals across the world are running out of staff as infected doctors and nurses go into self-isolation. US hospitals are dealing with their own staffing setbacks, with staff further strained with this new virus wave. Another problem is more people coming to the hospital seeking tests after waiting hours at multiple COVID-19 testing sites. In the UK, NHS medics were urgently called back from holiday or days off, mostly to keep hospitals running amid the healthcare crisis. More than 100,000 employees were off sick on Christmas Day. 1 in every 10 NHS staff were off sick or self-isolating as a result of contracting coronavirus during the festive season. The UK government has revealed plans for an army-style reservist force, one the NHS can call on amid periods of high pressure. In Australia, COVID-positive nurses are forced to work as New South Wales hospitals deal with severe staffing shortages. COVID-positive nurses were recalled to work in hospitals, a massive breach of state health protocols as hospitals resort to desperate measures. At one Sydney hospital, COVID-positive nurses seem to be limited to working in COVID wards. However, at others, nurses said they were treating non-COVID patients too. As for emergency services, the situation is similar in France. More and more police officers are getting infected. Around 25% of the national police staff have contracted COVID-19 since the start of the pandemic. 21% of New York Police Department, or over 5,000 of the force's 35,000 uniformed officers, were infected, self-isolating in the Big Apple. 30% of New York's emergency service staff and 18% of its 11,000 firefighters were also out sick. In Cincinnati, the mayor has declared a state of emergency, following the city's fire chief to adequately staff the department as firefighters fall sick. In the UK, rubbish bins, recycling containers are overflowing. This is due to suspended collections across the nation. Several councils up and down Britain have been forced to reduce or suspend services amid staff shortage. Councils are now redistributing staff between essential services to keep everything smooth and running across Britain. Meanwhile, over 4,000 flights have been cancelled across the world. More than half of the flights were cancelled in the United States, caused by staff shortage at various airlines across the country. More than 18,000 flights were even delayed, with the Chicago airport most affected due to flight cancellations. In the United States, the transit worker shortage have forced a cutback to train services, including shutting down 3 train lines. Other train and bus routes also have suffered across the United States. It comes as rail commuters returning to work across Britain this week. What most of them are facing are delays and cancellations. ScotRail has become the latest operator in the country to move to a revised timetable due to COVID-related staff shortages. For businesses, it is a hard start to the new year. Several businesses have had to close because of the virus. Now they face more uncertainty in 2022. Chicago will require citizens to be vaccinated for restaurants and gyms along with other indoor public places. In UK, major chains are dealing with shortage as they move staff between stores. The labour shortage has dampened pandemic recovery for Canadian businesses, with help wanted signs and job postings in storefronts across the country. In London, pubs and restaurants, the rates of COVID infections have been particularly high. Half of the staff are either sick or isolating. New York's already struggling restaurant industry has also been hit hard. Many establishments have been forced to shut down. Restaurants are facing serious challenges, from a critical labour shortage to fewer customers. This new surge comes as students are returning to classrooms in the UK and the United States. Ministers have told head teachers in England to start preparing for staff shortage. They have been asked to use support staff to fill in the gaps, combining classes or using hybrid learning, with some classes taught remotely and some face-to-face. In the United States, more and more children are being hospitalized with COVID-19, with local officials trying to decide how to safely start the new semester. In Washington, D.C., public school students and staff need to show proof of a negative test, a policy aimed at keeping schools open for in-person learning. And now for more on this, we were earlier joined by Head of Department of Primary Care and Public Health at Imperial College London, Professor Ajim Majid. Let us listen into what he had to say about this.
So I think trying to balance the economy with health, I think, goes together. When you've got very high infection rates, that does mean many workers being off work, whether they're working in the health service, in areas like public transport or retail. So I think both go together. You must really work to suppress the infection. And when you've done that, your society then works more normally and your economy works more normally as well. But it's hard to do that when your infection numbers are very high, which is why you must get infection numbers down to a more manageable level as quickly as possible. I think if you compare ourselves now in the UK and Western Europe to 1 year ago, things are now quite different. We've now got much higher uptakes of vaccines. So countries like the UK, Denmark, Spain, Portugal have very uptake of vaccines, including booster doses. And we also have new drugs coming online, new drugs to treat COVID-19, both by injection or by mouth. So I think it's now more manageable, the pandemic, than it was a year ago when we were very limited in what we could do. But now through vaccination and drugs, we can actually manage the pandemic much better than a year ago, which means that we don't need the same level of measures we had in the previous year.
WION is now available in your country. Download the app now. Get all the news on the move.